Okay then, so we've hit 2 p.m. I want to just kick off the session today because yeah, there's been some students who've been online nice and early, which is really great. And I know that we'll have a few more kind of trickle in over the next few minutes, but as it's 2 p.m. we're gonna start this session now. So as quite a lot of you know, I can see a few familiar names. I'm Ellie from Pathway CTM, and I'm going to be helping run the session today with some special guests who will be introducing themselves in a moment. But firstly, thank you so much for joining the session today. It's really impressive to be using this time while you're at home to learn a little bit more about these different brands, different opportunities, and also just get those kind of employability skills from these sessions that you can then talk about in your later kind of career, in any kind of applications that you're going to be working through in the next kind of months or years. And this is just great experience. So well done for all of the students who've already joined. Also, just thank you for kind of giving us those little bits of feedback in the poll at the beginning. So it's really interesting to see, before a session starts, where we're at in terms of expectations from the session and what we can really get out of it. So we've got an interesting result in terms of people keen to work in the charity sector. So we've got, 50% not really sure and 50% yes, and that's absolutely fine. That's great, because those people who are interested in going into that sector, brilliant, and those who are not sure, maybe today will be a really good chance to kind of find out a bit more of an answer to that question. There's a kind of like a little bit of a mixture between people who are joining today to kind of understand a little bit more about different jobs that exist in the sector, and some just to learn a bit more about the brand itself. So that's a nice kind of mix for our guests to know before they start the session. And we've got 50% of the students who have already been on one of our previous webinars in the past month with Cancer Research UK. So that gives us a nice background. You'll have that those other sessions and things you've learned from those for today. And some of those who this is your first time. So well done for joining today if you haven't been on any of our sessions yet. And that's really good for us to know about the timings of the webinars in the future and what works best for you students. So thank you for filling those out, that's great. As you know, we're here to kind of support you through learning a little bit more about what you can get out of your time at the moment while you're kind of working remotely from home. So in terms of an agenda for today, as you know, it's just a really good opportunity to get a chance to speak to some people who are actually firsthand working in the companies and can tell you a bit more about those different opportunities that are on offer. So they'll be able to tell you better than I can in terms of who they are and what their roles are at the moment. So just in terms of logistics, it's good to know that some of the students haven't been on one of our webinars before. So to be really, really clear, we really want you to ask as many questions as possible, to get involved, to use this opportunity. So there are a number of different ways you can do this. So the majority of you, I know, will be on some kind of computer or laptop and then therefore using the Zoom function. So that's what we're all on today. And if you want to ask a question at any point throughout the session, then we have the Q&A box on your left-hand side as you dial into the session. So go ahead and ask any questions at any point. You're not interrupting us. We really encourage you to ask questions. That's the whole point of today. So do that. And then if you have any other points that you want to make, like I've seen a couple of students already in the session today, just kind of saying hello and saying that you are on the session, that's really great. Like, I love seeing the students that are chatting in that chat box if you have any points you want to make throughout the session. So don't hesitate or hold back if you have anything or you want us to give a bit of clarity on anything, then go ahead and write anything in the chat box throughout the session today. So just in terms of a really quick overview, like I mentioned, we've had a few sessions with Cancer Research over the past 3 weeks. They've been one of our sponsors for this month, which has been brilliant, and we've had some really good sessions. So this is another instalment. And this is going to be talking about the different roles that are on offer in different departments. So giving us a bit of an idea of maybe some roles which you wouldn't necessarily associate the first thing that we think of when we think Cancer Research UK. So that would be really interesting. And as you can see, along with my video in the corner, you can see some other kind of guests who've joined us today, and which we're really lucky to have on the line. So you have a chance at the end, as well as throughout the session, like I just said, but to ask them any questions. So really do. When are you going to get the chance where you're sitting in a virtual room with lots of these different kind of brains and experiences? So go ahead and ask any questions. So that's the main section of today. What I'm going to do in terms of the very first thing to get us kick-started with the session today is ask all of you students a question, because I think that it's a really good way to get you kind of engaging in the session at first. So while I get up the cancer research kind of content that we're going to go through, then can I encourage all of you students to write in the chat box maybe an idea of what you think Liz or Izzy might do at cancer research and what department they might be in. So any guess? That's just a question that I'd love someone to take a stab at on the chat box. And there is no wrong answer. Liz and Izzy will not be offended by any answer. Okay, so we've got HR. Good guess from Charlie. Any other guesses? Public outreach, really good guess. Maybe testing drugs on animals. Researcher. Some really good answers so far. Anyone else? I'm going to give a couple more, and then I'm going to hand over to Liz and Izzy just to introduce themselves and what they do. Anyone else? Final guess? Administrator from Faith. Right, so I'm going to go, Liz, to you first. Would it be possible just to give us a quick introduction in terms of who you are and what you do?
Sure, my name is Liz Bertali and I work in the communications team at Cancer Research UK, and I lead a small team of press officers. So I work in the press office.
Great, and then over to you, Izzy.
Hi everyone, my name is Izzy and I'm a content strategist in the content and search team in the technology directorate, which we'll hear more about later. It's my job to kind of make sure that all digital content that Cancer Research UK creates is easy for everyone to understand, as cancer doesn't have any audience.
That's brilliant. So not exactly what any of the guesses were, I guess, for either of you. However, maybe some elements of them do overlap slightly. So in terms of the kind of content from a cancer research perspective, I'm going to be kicking off the session today and just talking about Cancer Research UK as a whole for the first little section of the session. So Cancer Research UK employs more than 4,000 people from a range of diverse backgrounds. It's united by an ambition to beat cancer altogether. They bring the courage and resilience to keep trying new things until that day comes. From research and technology specialists to fundraising experts and everyone in between. So as you've just heard, there's some other examples of people who are playing a big part in that. They're all key in driving forward scientific research that needs to make an impact. So therefore, that kind of first thought when you think of Cancer Research UK, all these different kind of roles are obviously fundamental in making that happen. So to achieve their goals, they believe that the three Cancer Research UK beliefs should shape everything that they do. They're looking for people who can show courage, problem solve, and work collaboratively to enable them to get where they want to be. So that's a really key, thinking about those three different things. If I was a student listening now, I'd be thinking, I'm going to take down those three things. So that was courage, problem solve, and work collaboratively. So they're kind of key things they pulled out there. There are a number of ways into the organisation, from early careers, which we had a session about at the beginning of this month, the graduate programme, paid internship scheme, and more recently the apprenticeship programme within trading, finance, technology and supporter services. So those are the 4 ones which they have an apprenticeship scheme for at the moment. So maybe jot those ones down as well. So that's just a quick overview in terms of who are Cancer Research UK, and kind of reiterating those points we made in the session at the beginning of the month around the different routes you can get into the organisation. So Cancer Research UK have a number of different teams in the organisation, and so they work on a number of different things. So firstly, they engage patients in fighting against cancer, so that's kind of the patient side of things. Secondly is campaigning. So remember we had that session last week around volunteering and fundraising, and I guess campaigning as an element to that. The third being developing new cancer treatments, so that's the scientific side of things and doing that. Fourthly, working with other policymakers and health professionals to prevent cancer, so that's prevention side of things and legality. And then fifth is very close to what we were talking about last week, so fundraising money which can be used to fund the research. So they're all kind of fundamental teams and elements to Cancer Research UK and what they do. So in terms of corporate services, this is maybe one that you wouldn't necessarily think of firsthand when you think of Cancer Research UK, and I think that's why it's so important to talk about this today, because I know we have lots of students who are really interested in this sector firsthand from having spoken to them. So when it comes to corporate resources, so Cancer Research UK's finance team helps them to beat cancer sooner by maximising the value of the supporters' donations and keeping them safe. So that's the financial side of things and making sure that money's going into the right places. They help Cancer Research UK become a more efficient, effective and resilient organisation by ensuring that all donations and money spent are accounted for as accurately and efficiently as possible in line with external regulations. So that's really key, just thinking about how the finances play a huge part in the overall mission of what Cancer Research UK are trying to do. So that's the finance team. And then moving on to kind of property and facilities. The property and facilities team is transforming, and a huge part of this is down to the exciting new office that they have in Stratford, that they moved into in Stratford in December 2019. So you can see that on the screen now for those students who are on the online function for Zoom. So they're building a team that's fit for the future. For all the change that will come their way in the next kind of 12 to 18 months, so they can continue to support everyone in the Cancer Research UK's offices efficiently and individually. So it's really important thinking about those roles. Actually, is that something that you think might work for you in terms of facilities and actually like logistics of where people and the company are based? So then moving down to legal. So this is a third one. Maybe you're interested in law and that's one route you're looking to go down. You can definitely do that at Cancer Research UK. The legal team helps Cancer Research UK to beat cancer sooner by providing essential legal and compliance support to the business, ensuring, among other things, everyone across the organisation is working with the same guidelines and contracts. So that's so important. If you're thinking about going down the legal route, that you can be doing it in the charity sector, and you could be doing it for Cancer Research UK. They have a whole team built around that. And then just finally going into, on this slide, sustainability. So this sustainability team are dedicated to managing the impact of the UK office, retail shops and their employees. So in terms of energy consumption, water usage, waste, recycling. Can anyone think of any other things which might play a part in that sustainability kind of team and things they have that might be taken into account if you are in that sustainability team? That sounds really exciting, being part of making sure the company as a whole is being, conscious of environmental impacts of the business as a whole. So that's one of the four sections on this slide which we're going to go into. So I wonder, is there anyone who it jumped out of them that one of these teams might be right for them? You don't have to put it in the chat box if you don't want to, but just have a think and do let us know if you see, as we're going through the presentation, that some of these other more unlikely in the sense that you don't first think of them when you think of the brand might be right for them. So those are just 4 examples of those other teams which don't necessarily, Liz and Izzy don't fit into, but they also exist at Cancer Research UK. So if any of them are kind of elements you think that might be right for you, then we can help support you on that, so do let us know. So I think I'm handing over to Izzy now.
Yep, sure. So I'm going to talk to you guys a little bit more about the Technology Directorate, which is the directorate that I'm in. So it's quite a large directorate within within Cancer Research UK. There's about 300 of us, and the types of different roles that you have in technology are so vast and different. When I arrived about a year ago, I was really surprised to see just how much the directorate offered and what kind of different people that I was like working with on a daily basis. So the technology department at Cancer Research UK kind of helps us beat cancer by giving us the value to the charity from technology, innovation and delivery. Our work ranges from award-winning approach to delivering digital marketing or helping kind of researchers with specialist scientific apps. And they're all kind of like operational, they're essential in our operation in trying to like cure cancer. We look to help CRU UK become more efficient, effective and resilient organisation. So that could be from the laptops that we use to the online software that we use. We kind of help people across the charity communicate efficiently so we can all get our work done. And all of this kind of like creates a fundamental kind of foundation for us to be able to bring forward the day that cancer is beaten. Sorry, I've lost my train of thought. Another part of the Technology Directorate is our website and our core sites. As you can imagine, our website gets thousands and millions of hits every day. And these could be patients looking for advice on cancer, or it could be a supporter wanting to make a donation, or a relative who kind of like wants to know how they best can support a relative of a cancer patient who wants to know how they best can support their relative. And we also have a really large user experience team as well. And they ensure that people at Cancer Research UK fully understand the needs of our audiences, and our audiences can be supporters, cancer patients, researchers, and people like that. And we also have an engineering department, and they largely help us with the software that we build. So that could be something like when a donor is making a payment, there's a kind of app behind that payment which ensures that it's secure, that the supporter knows kind of what journey they're following down to make that payment. So that's where our engineers would sit. And we will also have devs as well. So kind of there's a code behind every digital platform that you use. And that is what our developers kind of like help us to make sure that nothing is buggy and that everything is working and in order. So now I'm going to talk to you, I think, a little bit more about what a content strategist is and my role within CRU UK.
Sorry, just to jump in there.
Yeah, sure, go for it.
Question from Chinmay. Hi there. When you mean engineering, do you mean more network and software and IT engineering? I think you just basically answered that question, but great question.
Yes, so it wouldn't be the kind of engineering that's like building a bridge. It's more like digital engineering.
Great question, Chinmay.
Is there any other questions before I move on?
I don't specifically think on that section, but yeah, any students who do, then definitely go ahead and ask questions now, but not right now.
Cool. So I was asked to kind of like talk to you a little bit more about myself and my career path and how I came to be a content strategist. So firstly, I guess where my career began was in college with A-levels, where I studied English, media and history, and this kind of gave me an interest for digital marketing and media. The rise of kind of doing everything online was just starting to take off. So I decided to do a degree in advertising at Southampton University. And that was also where I kind of got my first taste of not-for-profit marketing and comms, because we did a module that was all about how do you market specifically for charities. So that's where I kind of first started to want to work for a charity later on in life. And then so kind of like after university, I took a couple of gap years and like worked, and it was really good to get paid work on my CV. So I worked at places like the post office in customer services, and I worked at the NHS as a receptionist, which was really tough. But working at those two companies gave me a real sense of what it was like to work for a public service, and also just the fact that people who used both those services, the post office and the NHS, come from all walks of life. And that kind of is what it kind of brings back to what I said earlier about how cancer doesn't have an audience. Sometimes in life we need to be able to make sure that everything is opened for all audiences so everyone can understand, in case they don't have English as a first language, or they might have a hearing impairment or something like that. So that's kind of where I learned to kind of be able to communicate with people from all walks of life. So after I took a couple of gap years, I then moved to London and got my first advertising agency job, which I was really excited about. And it was a receptionist office management PA role. So as I said administrator earlier, you were almost on the money. And this kind of gave me a good oversight of all the possible different jobs that I could kind of go into in an advertising agency, which was really good. And it was actually there that I got my first content strategist job. Part of my role as a PA was to send around office emails, and they kind of got seen by the right people, and the person who was head of content at the agency at the time thought that they were really funny and engaging, so offered me a junior copywriter role at the agency. So I stayed at agency for a further 2 years to develop my writing skills. And then after that, I decided that I'd go and pursue to be a content strategist. So after that, I then worked at loads of different agencies on loads of different accounts, from Coca-Cola to Facebook, Vodafone, Amazon, and New Look. And it was super varied. And it was really good working on loads of different accounts and thinking about loads of different audience types which would need my skills and expertise. But kind of I missed working for like people as a whole, if that makes sense. So when you work for Fujitsu, for example, you have a specific audience that you need to speak to. And my heart definitely spoke to wanting to make content and kind of apps and stuff visible for all people. So after about 6 years, I decided to leave the advertising world and make a break for charities. So I saw a job at Cancer Research UK and I applied for it, and luckily I got it, which is really cool. So now I'm a content strategist at Cancer Research UK. And what my day-to-day kind of currently looks like, apart from emails and chatting to my colleagues, is I do quite a lot of like thinking about comms and like copy and copywriting, and thinking about how I'm going to turn a piece of hard to understand information that could be, for example, from a doctor about a certain type of cancer, and just make it really understandable so everyone can use it. I also work with like the fundraising team. So for example, on Race for Life, I don't know if you've heard it, or Stand Up to Cancer, just to kind of like, they have different brand themselves as well. So just making sure that they've enhanced their brand and that it speaks to their particular audience too. I think that was all I had to say. I don't know if anyone's got any questions.
I have one question actually. So cool. I think it's really nice as well to think about the different journey that you've been on. Do you think if looking back at yours, maybe, well, I guess on the line we've got from 16 to 18-year-olds, do you think you would have known what a content strategist is? If someone said to you at that age, do you think you would have known, yes, that's for me? Or do you think quite a difficult question, I guess.
It's a really good question, and to be honest, I think when I started on my journey, so for example, when I applied for university, I don't think content strategy was really a thing. The digital world was like just starting to kick off, so websites at the time were super basic and people didn't use them that much, and it was only as time went on, when people started to use online services more, that the real need for content strategists came. And I think that's why it was good for me. So when I started working in an ad agency, I think I was about 20, and that's why it was so beneficial to work in a role like an administrator, where you talk to loads of different people and you get to know all the different kinds of roles. So no, I definitely didn't know that content strategy was a thing probably until about, I don't know, probably about 7-ish years ago, because it was always kind of like copywriter. And I guess the kind of thing that we have to remember is that roles do kind of evolve over time. So at one point there probably only was copywriters, and then when the digital age started to kind of evolve, more content strategists were brought in and user experience architects were brought in and stuff like that. Does that answer your question?
Yeah, no, absolutely. And Liz, I know we're going to move on to you now, but one really good question from Jessie has just come in, which I think we'll go for now because it's on the topic. So, hi, do you think that uni is needed for a job within content strategy, or would work experience along with an English A-level be enough? I know it's quite specifics, but I guess, do you think uni is the only route, or do you think other routes you can go down?
I don't think university is the only route, to be honest. I think because if I'm quite honest, in my first advertising job, as I went in as a receptionist, I got that job probably more on my experience working for the NHS as a receptionist rather than on my degree. I think the degree was more of just a nice to have. I didn't have any experience of working for advertising roles from my degree. I couldn't afford to do work experience while I was at university, because back then work experience wasn't paid. So I had to find paid jobs in like supermarkets and stuff. So yeah, I don't think you would necessarily have to go to university, but you might have to look elsewhere for that other work experience.
Yeah, no, definitely. And also, yeah, Jessie, we can support you with that and see if there's any kind of ideas from Pathway CTM we can do to help with work experience and things. So great question. So Liz, sorry, over to you now, and then we'll come back to questions at the end.
Hey, hi everybody. I work in the Policy and Information Directorate, and our remit is to influence and empower lots of different types of people. So there's people affected by cancer, so that could be people going through cancer and their loved ones and their families and their carers. And we also want to influence and empower healthcare professionals, so that could be clinicians, nurses, and also key opinion leaders. So that could be people in government or key clinicians that have influence as well. And what we want to do is we want to help prevent cancer, and we want to help diagnose the disease earlier. So if we diagnose it earlier, it's easier to treat and there's better outcomes for the person. And we also want to make sure that patients can access the best treatments. So there's lots of different teams in our directorate. So we have public affairs, who kind of do the influencing with government. We have the health and patient information, so you might see information for patients on our website, so that team is responsible for that. So they have to have basically, sorry, I'll backtrack a little bit as well. I think all the communications we put out is based on the latest research. So it's all based on evidence, and we've got different audiences. So as you can imagine, people putting together information for patients have to have that correct information. So that's so important that we're evidence-based. Then we have cancer intelligence, and they kind of look into kind of all the statistics and stuff you might see on our website. So looking at sort of survival rates for different cancers, and how common it is in different groups and ages. And then we have the patient involvement team, and they make sure that the patients are involved in all aspects of our work. So if we put out a campaign, or if we're lobbying about an issue in Parliament, then we make sure that people affected by cancer are involved in that every step of the way. And I work in the communications team, and I can talk a little bit more about that in a moment. But in that team, there's the media team, which is me, but we also have the news and content team, who are responsible for putting out all our great blogs you might have read on our website. And we have a social media team as well, so they look after our Twitter, Instagram and other social media channels. Then we have the health marketing team, and they also they make sure that all our brand campaigns are correct and are hitting the right note. And then we have a really important team who are the cancer information nurses, and they actually run a helpline. So anybody that's worried about cancer, newly diagnosed or receiving treatment or recently bereaved, can phone our helpline and speak to a nurse there. Are there any questions so far before I move on to the next slide?
No, not quite yet, but I'm sure they'll come in. I'm sure they'll
Okay.
get writing students.
So, as I said, I'm in the communications team, and I am in the press team. So our responsibility, our audience is sort of journalists, and who obviously communicate out to the wider sort of national public and international. So my team basically are responsible for publicising all the great sort of amazing sort of scientific and medical research that the organisation sort of runs, and we also provide a 24-hour news desk to journalists. So we have journalists frequently ringing us up, and they might be asking us questions about research that we've recently publicised, which is our own, or they could be asking us to comment on any other sort of cancer news story that they've seen that's landed on their desk. And they might ask us for what's our expert opinion in that, or they might ask us, say, if we've put out a story involving our research, they might ask to interview the researcher or someone within CR UK, or even a person affected by cancer. So we organise all of that. So it's a very busy 24-hour news desk. So any time of the day, research journalists can call us up. So within our media team, there's 4 strands. So my team is the science media team, and we look after kind of all the research that sort of comes out of our labs. So things that are looking at like the biology of cancer or understanding how it starts, that kind of thing. We also look after clinical trials in their very early stages. So when they're testing new treatments in people, I look after reputational risks. So if there is anything going on, like maybe bullying in the workplace in a lab might happen, my team would deal with that. And then we've got another strand, which is health media, and they look at more kind of that's more sort of on the patient level. So it's kind of looking at what can cause cancer, how it can be prevented, and they look at sort of bigger clinical trials that are closer to getting treatments towards patients. Then we have our consumer media, and they focus more on fundraising stories. So they look after things like Race for Life, any corporate partnerships we might have as well. They kind of put the stories out there around those sort of things. And then we have regional media. So we have a couple of press offices based all around the UK and devolved nations and Scotland. And they will deal with more kind of regional stories. So if you could imagine, sort of a national news story would be something like a big breakthrough in treatment or a new drug coming out, and that would make a national story for things like, you know, the Daily Mail and BBC broadcasts. But regional stories might have more of a local kind of focus. So it might be a local person that's been affected by cancer and their fundraising in locally. I should say, actually, when I talk about when we sell in sort of our cancer research stories, we can go to all sorts of media outlets. So that could be broadcast, that could be like BBC News, it could be Sky News, it could be online, sort of, you know, Daily Mail has online pages, it could be radio interviews as well, and obviously print as in newspapers. We have a whole other team that deals with like the researcher facing communications aspects. So we deal mainly with sort of what our public audience would be interested in. There's a whole other team that's not in my comms team that deals with things researchers might be interested in. So any other questions before I move on?
That's brilliant. We've had quite a few questions actually, so I'll go through them now. One question from me. So when you're going through those different kind of responsibilities and of the teams, I guess if you're, for example, in an element of your comms team which is kind of a scientific focused one, do you tend to have employees who come from a scientific background, or do you have for the element of your team who are looking after like the corporate side of things, do they come from a corporate background, or is it more just all from a journalism media background, if that makes sense?
Yeah, it does. Good question. So in my science media team, we're all scientists. So we've all got degrees, not necessarily PhDs. I haven't got one. I can go into that in my next slide anyway. So definitely for science media, because you're looking at like quite heavy scientific papers that get published. So you have to have a good understanding of science. We ask for like a biological science. So it's sort of on, more more than sort of physics side of things, just because all our research is around mainly biology. In the health media team, I do believe they are also have a science background, but the consumer media team, who focus on the fundraising and corporate partnerships, they don't have a science background. And the same with the regional media team, actually, because they come to my team to ask for scientific input if they need it for any of their stories.
Okay, that's really interesting. Yeah, it makes sense. So I'm going to go into some of the questions coming into the Q&A box. So as you know, students, you can also ask anonymous questions. You don't have to have your name on there. So first anonymous question. Hi, the cancer information nurses, obviously you're talking about for the 24-hour helpline, do they also directly treat patients who are diagnosed, like going to their homes if there's a problem, for example?
No, so they're kind of there to offer support. So we always say to people who are affected, who are going through cancer diagnosis or treatment, that they should go to their GP for advice. That's the first port of call. But we can kind of, we get calls, they get calls, not me, like asking, they might be newly diagnosed, say with lung cancer, and they'll be like, I'm really worried about, it might be something like, can I eat like soft cheese or something like that? And they'd be able to give advice like that. Or somebody might be, I'd like to know what clinical trials are available for me, for my condition. And they could provide that information, but they would always say those sort of medical choices and decisions are always with the treating sort of clinician. So it's just there to provide emotional support as well. We can direct them to other helplines or give advice, for other things. But actually, we don't have nurses that go out and treat people with cancer. We just we've got their nurses, but they just provide advice and support.
Fine. Okay, makes sense. Great question though. Well done. And Hema, hi, this interests me. That's brilliant. We love to hear that. How do you get to doing this in the future, as in like a job? So Hema's interested in being you in a few years' time. What recommendations would you give her?
I think it's just worth kind of getting your head around kind of if you want to go into sort of in a press team in a scientific sort of background, I think it's worth getting your head around kind of what makes a good news story, in terms of like what makes a good science story. So you can see, there's always like the Daily Mail love like anything that causes cancer, to be honest. So we get quite a lot of pickup from them that, you can see like from them, it's always like breast cancer, prostate cancer and bowel cancer are like, they find that really interesting. And there's different journalists that like different stories. So I think it's also worth kind of thinking about like what makes a story coming out newsworthy. So you might think, oh, it's really interesting, but would actually the public find that interesting? So, we might get lots of papers coming in and a researcher might be, this is the best thing ever, like this research is amazing. And you'll be like, let me just read that paper. And then you're like, probably not for this audience. But then you'll get a paper that will land on your desk and it might be, we've uncovered a new cause that causes bowel cancer. And you're like, that's really interesting. And they might be using interesting tech or an interesting technique, or in say certain cancers, like the survival rates are still really bad, like in lung cancer. So any lung cancer story that comes out that could help sort of knock down, increase survival rates, then we'd be like, oh, that could be definitely a good story to tell. So I think it's just sort of getting your head around what has news value in a story would be really useful. And in terms of kind of getting to get experience in a press team, I mean, I'll go into it in the next slide. I went around it in a really, really sort of convoluted way, but we do take people on that have recently graduated. I've got someone in my team who is he's recently graduated and he's doing an MSc actually in science communications, but sort of he's part-time. So we do take on really junior people in our team and train them up. I think, to be honest, for press work, it's just learning on the job. It's just kind of being in a busy press office and understanding like how it works, because it's hard to kind of sit down and read about that. I think you just got to throw yourself in and go for it.
That's brilliant. That's great advice. And actually, well, Nicolaj, I know you've got a question there, but I'm actually going to move on to the next section, and we'll come back to your question because I think we might address it in this slide here.
I think somebody guessed that maybe one of us was a researcher, and I was. So I did a science degree, and then I went on to do an MSc. And I love science from a really early age. Really, sort of, the thing in the middle says, remain curious and keep learning. This is me. I've just loved learning new things, and science kind of ticked all those boxes. But I got to a point where it was like, do I want to stay in science and in the lab? And if I did, I'd have to get a PhD, which means another 3-4 years of hard slog. And I just thought, no, that's not me. And my real love was just talking about science, learning about science, and writing. I loved writing. So I thought, right, I'm going to leave, life in the lab, which was amazing, and just like go for it and jump in. So I just went through an agency actually, and managed to get like a really short-term writing contract at GlaxoSmithKline, which is a big pharma company. And it was writing, so they were sort of putting together sort of drug, sort of any sort of, so if they want to license a drug, you'd have to like research all the safety data and all around it and like write up a package. So I did that for eight months, and I was like, this is not the type of writing I really want. So I thought, right, I'll just kind of jump about. And once I got that, just that initial experience, I think, just that initial kind of like, I've done a bit of writing, and we write for different audiences. So I just wanted to learn writing for different audiences. So I managed to work in lots of different places. So all different sort of places where I was writing very technical sort of packages. And then I got a job in a medical communications agency, which is where you get to do all sorts of stuff like putting together slide decks for pharmaceutical companies. So would have different clients, which would be different pharmaceutical companies. So they might have like an asthma drug. So I'd help them sort of write communications around their asthma drug, go to conferences, write slide decks for people presenting data on the drugs there. And that was really great. I got to travel loads around the world, got paid a lot, but then also felt it was slightly soulless. And I think I just wanted to kind of give something back. So started exploring the non-profit sort of arena, and I landed a job as a science writer at the Institute of Cancer Research, which is part charity and part research institute. And this is where I really found my feet, because they just started up a communications team there, so it was very young. So I got to pick up so many skills. So it was things like their corporate publications, but also like feature writing, tweeting, blogging, going to conferences. I designed the stand at a conference for them. I manned the stand, and live tweeted at conferences, and just picked up so many skills there. But I found also it probably wasn't completely suited for me, because I really wanted kind of that patient angle, because as a research institute, it was very focused on like finding new drugs, which was great in cancer, but I just really wanted to kind of get to explore more about kind of how this all fits in with people affected by cancer. So this is where I think I really started thriving, and I got a job in a small blood cancer charity, and again it was a new role, so I was allowed to kind of shape that role. And because not much was done in terms of communicating about their research, I had free reign in kind of doing whatever I wanted there to a certain extent. And I just absolutely loved it. And I think it was the first job, and it's quite late on in my career, that I felt really thrived. My confidence just built so much there. And I think once your confidence builds in a role, that just like really gives you good foundations for everything else. And I just absolutely loved it. And I didn't actually really want to leave, but I felt I'd reached a plateau there, and I felt I wasn't learning so much. I wanted to manage a bigger team. I wanted to be in a bigger place. It was quite a small charity. And last year applied for this role at Cancer Research UK. So here I am, and I'm definitely in a bigger organisation, which comes with, it's very different from a smaller charity. It has its pluses and minuses, as with a smaller charity. And now I lead a team of 3 press officers, so they vary in experience. Like I said, I'm sort of managing somebody that's quite fresh out of graduating, but then I've also got quite seasoned press officers there. And yeah, it's a very busy job. There's lots of pressures, but it's extremely rewarding. And I must say, absolutely no day is the same at all, which I love. I mean, some people don't like that and they like routine, but my day is never the same from day to day.
That's brilliant. And I suppose that you know, we always tend to say this when we've got case studies of people on our kind of webinars and sessions over the last month or so, which these students will have been on, that like often career paths, they're not just you decide what you want to be and then you go straight there. There's roundabout ways, and the experience that you pick up on the way is invaluable. But now I'm going to go back to Mikolaj's question, because I think it does tie into your kind of story about how you've got to where you are. But hi, what kind of steps would need to be taken after A levels in order to join press teams and charities? Are degrees in science health needed in order to report on these topics? So we know that actually, you know, in your team, those scientific ones, that you would need a scientific degree. But I guess if you were in Mikolaj's position right now, what would you be thinking about in terms of kind of the next steps in order to move towards where you are now?
I think it depends. There's press teams beyond kind of research charities as well. You know, you've got the Red Cross, you've got Save the Children, you know, you've got these sort of international kind of charities as well. So they probably have different sort of remits in terms of kind of if you need a degree or whatever background you need to go in. So it might not necessarily be science, but I mean, I totally would take on somebody also in terms of if they had a bit of experience working in a science press team, but not necessarily a science background, but it's just kind of having that sort of, I guess, background and that capability of just be able to understand the science. But I think for other press teams, it might not be so stringent, maybe. I think it's just worth actually probably even contacting press teams and just saying, you know, I'm sure they probably do get a lot of interest from, you know, students in your position, and you know, just wanting to know like what's the best route for me to kind of get into an organization like yours in the press team, and they'll be able to give some probably some sort of clearer guidance, I think.
Yeah, no, definitely. That's great advice. And if you need support on that, Mikolaj, we can help you do that after today. So Rachel, I'm going to give you a shout out, Rachel, because I've seen you in about 4 webinars this week, and I think that's really impressive in the past 2 weeks. But well done, great question. So how did you make the decision to make the changes throughout your career to where you are today? So you've been through a bit of those kind of journeys, but was there a point at which did you get that point at which you how did you make that decision, for example, when you're in your last place to come over to Cancer Research UK? What was the trigger?
Is this me?
Yeah.
Okay. It was really, really hard. So I was at Blood Cancer UK before, Bloodwise it was called, and it was really, really hard for me to leave there. And it was probably one of the most difficult decisions, other than, you know, I did lots of job hopping around, but because I was very comfortable there. I was expert. I was top of the game, and I knew everything. I felt like I knew everything, and I felt like I couldn't really learn anymore. And like I said, I just love learning, and I like being out of my comfort zone. I really do. And being a Cancer Research UK, I mean, I am out of my comfort zone quite a lot, but I quite love that. I don't feel like ever like I'm like completely out of it and there's no support. There's always support around me. I think that's really important as well. But when I was at my previous job, I think I just got a bit bored, really. I just felt it was a small charity. I couldn't see where I would step up. So I was sort of at a managerial position there. I was managing 1 officer. I wanted a bigger team. They didn't have the resource to give me a bigger team. I couldn't see where I would step up in, say, a head position where I'd be managing more people. Because I think that's one thing I really learned at my previous job as well, that I was managing an officer there who was brilliant, and I just love training people up. I love like mentoring. I love kind of teaching, seeing people grow. And that sounds really cheesy, but like seeing people like do well. You know, they start off really nervous, and then, you know, their confidence builds, and you can see them growing and blossoming. And I really love that. So for me, like managing a team is just really, as well as the science and the whole craziness of the job. But I think for me, like managing a team with really different personalities and challenges is what's making me really thrive at the moment. That's my learning thing, because I don't, you know, by all means, I don't know everything about, you know, cancer research, but I do feel I've got a lot to learn in terms of managing people, and that's kind of where I'm getting my buzz from at the moment.
Absolutely, no, that's great reason to kind of want to move on and make those decisions. So one question from me then, so I'm going to go to Izzy first. maybe not even like logistically in terms of, because I know some of the students have asked this question about how would I get from A to B, or what would you recommend? What was one piece of advice you kind of would have given yourself looking back to that kind of age when you don't necessarily know exactly what role you want to do or exactly what industry you want to do? Is there one piece of advice you'd give to yourself at maybe a 16 to 18 year old?
That's a really good question. What advice would I have given myself? It's just basically probably just like take it on the chin. Basically, like, not everyone's going to say yes. You only need one person to say yes, and don't let the knockbacks let you get your confidence down. Like, you are enough. You've all like studied, and you're all on this webinar now, so you obviously do have a kind of like hunger for this kind of thing. So just don't give up. It's a really difficult world out there, but as Liz has like just so kindly said, there are people who do want to see people kind of like gain their confidence and grow. So yeah, just don't give up, I think, which is easy to say, but
no, that's brilliant. And that's kind of not only in general but topical at the moment, I guess, like resilience and thinking about, you know, getting through difficult situations. It's been such a brilliant session. I'm just conscious of time, actually, so I know we're usually around 45 minutes, so well done. I mean, everyone stayed on the line, and I just want to make sure that we have a kind of wrap up at the end. So first and foremost, it's like, just thank you so much to Liz and Izzy. It's so interesting hearing about these different roles and kind of your journeys throughout your careers so far. So thank you so much for your time. Secondly, thank you to all of the students. I'm like continually impressed by the fact that of the students are kind of dialing in every single day. So that's amazing. And if you have any questions on anything for today's session, you know that the Pathway CTM team are here. In follow-up from today, I'm just sharing now in the chat box is a quick kind of type form survey to get a little bit of information. So for example, if you've seen different roles in today's session that you think might be right for you, and then therefore you need a little bit of support from our side to help you think about next steps, then definitely go ahead and complete that. We will follow up with every single member of some people that have signed in today, just seeing if you need support and seeing where we can help support you further. Faith, that's a lovely kind of comment to end on, so thank you for your time and telling us about your role and pathway, for getting you on here. So yeah, no problem at all, Faith, that's what we're here for. And we'll record the session today, so anyone who's missed it, we can go ahead, we can share that recording with you. And we've got a last really quick question from an anonymous attendee, just based on the fact of your journeys, and I'm going to finish on that. So Liz, I don't think you've worked at a smaller charity, had you, Izzy? So I guess that question is for Liz.
Yeah, I didn't work at a charity before Cancer Research UK. So
yeah, so Liz, just quickly on that one, just so from the anonymous attendee to get a quick answer on that one. What was better at a smaller charity?
So in a smaller charity, you've got more scope to make change. So for instance, if I had an idea, the chief executive used to basically sit at the other end of the office, and I could book some time in with her, and I'd be like, hey, I've got this really great idea. I'd like to do X, Y, and Z, like put a bit of a case to her. And she was the type of person that would be, that sounds great or bad. So if it was a good idea, she'd be like, well, you know, what do you need from that? I can do that right now. What do you need? Who do you need to get in contact with? What resources do you need? Let's do it. At Cancer Research UK, you know, it's absolutely, you've got a platform to air good, you know, ideas. It's just a slower process to kind of get there. I think also in a smaller charity where I was, because it's a smaller team, it was just a smaller team who I was working with. So as I overviewed, like the policy and information director is huge, but where I was working, like there were like maybe 10 people doing all of that. So you'd be really connected in terms of kind of what they were doing, and you could literally stick your head up going, who's speaking to this researcher today? Like, what, you know, are you going to Parliament today? And, you know, we do have that communication at CRUK, but it's just a bit slower getting around. Whereas in a small charity, it's really dynamic. But in a smaller charity, you've got less scope for probably career progression. There's probably less resources. Cancer Research UK, I mean, I was just bowled over by like what it's achieved over the years. It's just amazing. And whereas smaller charities probably don't have that impact. So, you know, there are pros and cons at both places, but equally great training grounds and getting experience.
Brilliant, thank you. I just hate leaving questions unanswered, so great for asking the question, even though we were just finishing there. So brilliant, and yeah, thanks for all your time today. Yeah, have a good rest of the day, and we'll send around a follow-up to everyone who's been here. So thanks.
Okay, thank you all.
Bye.
Bye.